She's a triple threat, everyone. So the first question I have, and I think something that the viewers are familiar with from our practice, is that we offered a fleur-de-lis paniculectomy for the patients. That was like the extent of what we would do in terms of, and we specifically said that from our standpoint, because we would do it for insurance, that it wasn't a cosmetic procedure, that we were doing it for paniculitis and increasing their quality of life. Just from your experience, what is a fleur-de-lis paniculectomy and how does it differ from all the kind of paniculectomies that can be offered?
And what their expectations are, as well. I typically do body contouring like liposuction, like 360 liposuction with all of my abdominoplasties, no matter what kind we're doing, just because you want to avoid that square look. So when you're talking about bringing that skin down and forward to remove it in your typical like horizontal abdominoplasty, if you've got a lot of excess still in that, vertical section of the abdomen, the patient may not get the firm, flat abdomen that they are going for without having that skin removed. I would say it's very patient specific, depending on the amount of excess skin that they have. But most of the time, if patients have lost more than 150 pounds, we are typically looking at doing something like a fleur-de-lis for them to have the best shape and result that they can go for. And I would say, I know that scar burden is always a stressful thing for patients. They want to have as little scars as possible. They've already been through so much. But realistically, if you take care of your scars properly and you're exercising good surgical technique, they really turn out really well. And I would say in addition to that, that your post-healing scar care, in addition to adding on things like laser resurfacing, medical tattoo shading, like all of those things can essentially get you back to a very near pre-scar skin quality.